Good afternoon, everyone. It's my pleasure to welcome you today to the AMS-Fitzgerald Fellowship in AI and Human-Centered Leadership info session for 2025. My name is Jennifer Gibson. I am the Sun Life Financial Chair in Bioethics at the University of Toronto, an associate professor and director of the Joint Centre for Bioethics in the Dalla School of Public Health, and director of the AMS-Fitzgerald Fellowship. I'm joined today by Mr. Terry Ewan, who is Administrative Assistant for the Joint Centre for Bioethics and will be assisting in moderating today's session with me. Before we start, I would like to highlight a few housekeeping items. Today's information session will be recorded and posted on the AMS-Fitzgerald Fellowship Program page on the Joint Centre for Bioethics website for those who are unable to attend today, and for anyone on today's call who may wish to refer back to the recording. We will be using the chat function for the Q&A portion of today's information session. Terry will assist me in moderating questions arising in the chat. Your question may be read, but you will not be identified by name. And for additional clarity, only the audio and video recording will be posted publicly for others to view. So in today's session, I will provide you with an overview of the AMS-Fitzgerald Fellowship, what it is, who are the fellows, what do fellows gain, how the fellowship works, how to apply, and some next steps after the application process, and then open up for your questions to help guide the information I can share with you. Artificial intelligence promises to transform health systems at all levels. At the micro level of direct patient care, at the meso level of health institutions and care coordination, at the macro level of broader public policy. And all of this promise has profound implications for reframing patient-provider relationship, for fostering or not effective systems and efficient delivery of health services and public health policies, promoting health, preventing disease, enabling healthy public policies. And the success or failure of artificial intelligence in health will depend heavily on organizational leadership and culture. And it's within this emerging AI landscape that you joining me today and the current fellows within the fellowship are being called to be bold and to be critically reflective about the use of AI in health systems and health institutions and in health settings, and to seek ways to strike a balance between the transformational opportunities of AI application in health and the fundamental core values of human-centeredness in healthcare, public health, and health systems that really connects all of these interventional activities with real people where they're at. The AMS-Fitzgerald Fellowship in AI and Human-Centered Leadership is a response to this evolving situation. It's a professional learning fellowship that was created in partnership by the Dalla School of Public Health, AMS Healthcare, an Ontario-based charitable organization committed to innovation through compassion in care, and the Joint Centre for Bioethics, which I have the privilege to direct, with whom we are collaborating with OIZ Continuing Professional Learning to deliver a great learning experience with our fellows. The AMS-Fitzgerald Fellowship reimagines a human-centered approach to leadership that is driven by putting people first and by a commitment to promoting, fostering, and advancing compassion and equity in an age of AI. It is designed to foster the knowledge, skills, and competencies of health system leaders, seeking to implement AI or related digital innovations for compassionate and equitable healthcare in today's health institutions and systems, as well as those in the future. And it is designed ultimately to foster not only the learning goals of the fellows themselves, but to foster the development of a cadre of human-centered leaders in this AI environment by building a cohort a community of practice to support the positive transformational change within our health systems. So who are the AMS-Fitzgerald Fellowship, or who are we looking for to join our fellowship? AMS-Fitzgerald Fellows are early and mid-career health leaders, particularly in Ontario. Our partner, the AMS Healthcare Charitable Organization, is based in Ontario and has a core mission-based commitment to supporting development within Ontario. However, we do also have the opportunity to invite fellows from other parts of the country and internationally on a case-by-case basis. An ideal candidate in the AMS-Fitzgerald Fellowship, as we are discovering, has at least 3 years experience in a health leadership role, is currently working in the health sector, is a visionary, transformational, and action-oriented leader, is committed to a human-centered approach in their leadership role, has experience in leading change or being part of leading a complex change initiative or implementing innovation in their work settings, has strong support from their organization to participate actively in the fellowship, and who we believe will make a valuable contribution to and enrich their cohort. Just to give you a sense of who our current fellows are at the moment, our fellows come from a diversity of health institutions and settings. Some affiliated with the Ministry of Health or a provincial health agency, a hospital or public health unit, a data or business intelligence unit within their health institution. They may be in primarily institutional settings or be more strongly connected to a community-based setting. There are some who hold leadership roles within research institutes, and others that are working with an AI incubator or startup context as well. Our current fellows across the first 2 cohorts of the fellowship have a diversity of academic and professional backgrounds in clinical care, nursing, medicine, in public health, in management or business operations, in health informatics, and health policy, and in ethics. On average, our fellows have at least 7 years of health leadership experience, and some have upwards of 20 years experience within the health system. So we're folks who really understand how the current system works, but are finding themselves at a learning space again in their leadership roles as they see this evolving and emerging AI ecosystem unfold. Some of the top role positions that our fellows hold are things like they may be chief information officers, they may be policy or strategists within their institution or their ministry, they may be clinical or health services managers or directors in their setting, some may be directors of administration or operations in their setting. Some have a role that might be aligned with being a chief data scientist. Some are clinical leaders, policy analysts, research directors, or executive directors of health system portfolios. So a really nice, actually, map. Our fellows really reflect a map of the different ways in which we as citizens, as patients, and as providers intersect with our health system. And also one of the reasons why we're really interested in cultivating cohorts is because each one of the fellows as a learner is also a capacity builder in the cohort by bringing their expertise, their experience to help foster the shared learning of the group as a whole. So what do fellows gain from the fellowship? First, we are really aspiring to foster a connection and engagement with leading experts in the field. So that they can bring their experience, so the experts in the field can bring their experience. But what we hear from many of our experts and residents that we bring forward is how much they value hearing the questions from the fellows themselves, because each one, whether they happen to be an expert in residence or a fellow, is shedding light on a rapidly evolving situation. Some of the expertise that our experts in residence bring, our expertise in AI or in data science, health system leadership, and in diffusion of health innovation, in law, regulation, ethics. And in fact, in many ways, what we're finding as the fellowship evolves, it can evolve in real time. And sometimes we need to call on expertise that was unexpected at this particular time. If you just think about the ways in which legislation or regulation unfolds, very often that creates an opportunity for us as program team to say, what expertise now do we need to be bringing in to connect with our cohort? You'll develop insight into current and the current and evolving health AI and digital landscape in Canada and internationally. You will develop some core knowledge about artificial intelligence. Not everybody coming into the program is really deeply familiar with all the technical aspects or the data aspects of artificial intelligence, but will provide sort of a level setting for everyone to work with. But then also, really, because you're coming in as a health leader, it would be how do we work with you to foster the development of your practical skills in leading AI innovation and design in your own institutional setting. With that, you will be able to define and clarify for yourself a vision of human-centered leadership for your practice. Many of you are already human-centered leaders, but with this, in this AI environment, how might greater clarity, greater definition support you in being able to lead in this changing environment? You will receive both expert and peer mentorship on an AI innovation leadership project, which you will be leading in your own institution. I'll say more about that in just a moment. Also, you'll acquire a repertoire of tools, models, and resources. And in fact, one of the things that we're finding is that the fellows themselves, they will find a tool, they will find a framework, they'll find a great paper, they'll find a great report that has just been published, and they bring that to the table and share it with each other. So it's really a co-created repertoire of tools, models, and resources. You'll gain, importantly, and this is something we hear from our current fellows all the time, is really the sweet spot here is that you get to work with another 11 or 12 professional peers and build a community of practice together and learn with and from each other. And now that we are moving towards recruiting for the third cohort, we're having the opportunity to develop relationships between cohorts. So you've got a primary cohort of 12 fellows, but it's really a cohort of around 24 and then eventually 36. We're building this community of practice of human-centered leadership in relation to AI. Finally, at the end of your fellowship, you'll achieve a certificate of completion that's recognized both by the Dalla Lana School of Public Health and by OISE Continuing and Professional Learning. So how does the fellowship actually work? So the fellowship is designed to be completed over 2 years. In year one, the fellowship will focus about building some core knowledge and skills related to with respect to 3 highly integrated modules on human-centered leadership, on human-centered applications of AI, and human-centered design, which will support each fellow in the discovery, definition, and development of their individual human-centered AI or digital innovation project. So each of you will have the opportunity to work on a human-centered leadership project that is important to you, but also your institution. And this will be guided both by expert and peer mentorship. But a really key component of our fellowship program is that we have the benefit of an expert process facilitator provided by OISE Continuing and Professional Learning, who is an expert in leadership development and professional inquiry, who brings her years of working with professionals like yourselves around leadership to be able to support your ongoing development as you go through the program. Finally, as I've noted a few times, this fellowship is designed on a cohort model, both within and across cohorts. So our very first cohort didn't have the benefit of subsequent cohorts. And so joining the fellowship program in 2025 would mean that you have 2 cohorts, sort of an expanded community of fellows from which experience and expertise you may draw. So this gives you a bit more of a sort of visual snapshot about how the program works. You can see that there are 3 modules that we'll be covering in the first year through both residency in September, the last week of September, a residency the last week of January, in the wintertime, and then a third residency period in May in 2026. Each of those explores a dimension of human-centeredness. Of course, these are cross-cutting themes. So thinking about human-centered leadership is a theme that will carry all the way through. And then how that applies to artificial intelligence itself, and how it applies to the design of AI, leading up towards thinking about, and then what does this mean for practice? So in the first module, we'll be exploring the current and evolving landscape of AI, health AI in Ontario and Canada and internationally. In the second module, we'll be evaluating and supporting your work to evaluate in your own context your organization's readiness for AI innovation. In the third module, we'll be exploring more about enabling AI innovation with much more of a focus on design and application in these contexts and lessons learned from recent experience, especially from some of our experts and residents who've been on the ground, exploring AI innovation development and delivery in their settings. And then finally, implementing AI in practice. And you'll see there there's the line there that is discover, define, develop, and deliver. Overlaid on this is a 4D design model that supports the development and evolution of your individual leadership projects as well. So this AI innovation project is built iteratively over time, supported by each of these modules, supported by each other, and supported by the experts and residents who are participating with us in the fellowship. So let's pause to think then about how to apply. There are 3 components to the application, and please note the application deadline, which is in a few weeks' time, on May 2nd. You would submit your application to the email address noted on the screen. So the application itself comprises 3 components: a statement of interest, approximately 3 pages, a professional CV, about maximum 3 pages, and a letter of institutional support from a senior administrator in your organization. So I will spend just a moment to walk you through each of those 3 components to give you some insight on what we have in mind for each. So in the statement of intent, we're really looking to understand from you a bit more beyond what your CV may tell us, about your leadership experience and your current role, including how it relates to AI innovation or digital innovation in your institution. It would be, so here's what I've done, here's my leadership experience that I'm bringing in. And in fact, some of our fellows have a number of years of experience, and have also taken leadership training programs before. And so we're bringing that with them, which is really valuable for us to understand. But then how is the evolving AI landscape becoming a more important or central or key component of the role that you may have? Second, we'd like to have an insight into your interest in the program, why you think you're a good fit for the program, and why you think this program is a good fit for you. What is it that you hope to gain from this experience? A little bit about your proposed project. Of course, throughout the 2 years, and particularly in the first year, you will be discovering, defining, and developing your project. But what do you have in mind? What is your institution struggling or grappling with right now that you think could be a promising avenue for you to turn into a project for your fellowship program? And why or what about this particular project calls for a human-centered approach? Why is that needed? Finally, we're really interested too, given the cohort model, what it is you think you could bring. Is there some unique expertise or experience that you think could be uniquely enriching for the cohort? Share a little bit about that with us so we can factor that into some of our thinking about what the cohort may look like. In terms of your professional CV, many of you may have a 2 or 3 page CV already, and that's great. And some of the things that we're curious to see there are, so what disciplinary or training background do you have that can be enriching for your learning? What do you already have skills and competency in. And so then how does the fellowship then potentially actually add on to or amplify what you may already have experience in? Relevant professional employment experience. It doesn't need to be exhaustive, but what are some of the things that you think is really important for us to know and understand about your professional experience? And certainly in that CV, certainly it'll be important for us to see what your current and previous leadership roles have been. And then your letter of institutional support. Now, this is really important. This isn't really a reference letter. I mean, it may involve some elements that talks about how skilled and wonderful you are and why this, but really this is a signal that your institution is supporting your participation in this fellowship, that it is endorsing your participation to do this. And so in that letter of support, this could come from the person you report to, for example, or somebody who is in a position to be able to provide this level of institutional support to you. We would love to be able to see there, what are some of the tangible the supports that your institution will provide to you. For example, that might be release time for those 2-day in-person residency periods. For those of you who don't live in the Greater Toronto or Hamilton area, could be tangible support, could be in the form of covering your travel costs to be able to join us. Second, it would be important in your letter of institutional support for the person who's writing that letter to describe the importance or the value add of your proposed project idea. And so why is it valuable to the institution? So why is this in the interest of the institution that you happen to be there? And then why you are ideally suited to lead it. But then of course, we're all learners here. And so it may be really important too for you to know that you have a mentor or a sponsor in your own institution who can be a sounding board as you start to think about how your project actually inhabits that workspace where you are, the institutional setting or the network of collaborations and other parties to that work. And so here, it's important to specify in the letter who your institutional sponsor might actually be, who would be your sounding board to provide mentorship and guidance and help you navigate, especially if you're in a larger or complex institution, navigate advancing that leadership project. It could be that the institutional sponsor is the person providing the letter, or it may be somebody else adjacent with other relevant expertise to do so. Okay, so after applications come in, just to give you a sense of what next steps may be, myself and my colleague, Professor Jay Shaw, who's research director of AI Ethics and Health in the Joint Center for Bioethics. He and I will be conducting interviews on May 26th and 27th for eligible applicants. And then what we are anticipating is to be able to make admission offers in June, the first week of June, so that especially for those who are clinically engaged, can actually free yourself up to be able to work with your colleagues to be able to free yourself up for the residency dates, but also for you to be able to start planning for what the September may look like. And then June and August will be a time of onboarding, getting you settled, connecting with the process facilitator, and a few administrative steps at the University of Toronto to give you full access to the online tools that we have available to us. And then we will be circling back to the fellows who've been accepted into the program and have accepted the offer to talk about how we communicate this out publicly. So there are a few of those steps that we'll work with you over the summer months. Okay, so now it's an opportunity for question and answer with you, and I'll just pause for just a moment here on this slide to draw attention to two contact links. One is a link to the email address to which your application would be sent, but also where you can send your questions and queries if anything comes up after today, which is posted on the screen, and Terry will pop into the chat for you to be able to access. And we also encourage you to, after today's session, to log on to the AMS-Fitzgerald Fellowship page to read in greater detail about the program. And some of the information that I've shared with you today is just a good memory prompt for you. And you will find that information there. And again, also information about how to connect if you have questions after today's session. So for the question and answer portion of this, as I've noted, we are recording this session. And so we're asking that you use the chat function in order to pose your questions. This is to ensure that no one else's but Terry's and my faces and voices are on the publicly accessible recording, which we will be tidying up for that little interlude that needs to be one of the slides that needs to be cleared. And Terry will read off or will summarize the questions as they come in, but will not identify anybody by name. So I'm going to stop sharing screen, and then Terry, if I could just ask for you to moderate the question Q&A portion, that would be great. Thank you for your attention, everyone.
Thank you, Jen. Coming in fast and furious on the question, so let's get right into it. The first question we have is, can you provide an example of the type of projects that previously cohorts have undertaken?
That's a great question. And so a couple of things. Every institution is at a different place in its exploration of AI innovation. And so that will largely dictate the type of project that you might be engaged in. So some of the projects that, and this is partly a learning journey for us as well, we've realized that people are at different places in their own development, but their institutions as well. So some of our fellows have actually been much more engaged in data infrastructure processes, really consolidating the data infrastructure, working around that as a really formative foundational piece of work to be able to even contemplate enhancing data intelligence activity or AI activity within their institution. So an infrastructure type of project. Some organizations are very early even exploring the possibility of using AI. And so it's much more, some of them are engaging much more in strategic projects that might actually be about clarifying the types of needs that might be in the institution, so a needs type assessment. It might also be, as some of our fellows have found, sometimes it's really about sort of engaging up within the institution, working with the board, working with the executive team to clarify a vision for the use of AI in their settings. So much more of a strategic visioning type of project. Some are actually at the stage of developing frameworks or processes or protocols within their institutions. One organization, for example, is starting to think about developing a unique research ethics board for artificial intelligence types projects so they're really thinking about what would that operationally look like? What would be the ethical framework around that? What would be the protocols and policies that are required there? Just to use that as an example. There have been some of our fellows who are actually at the level of they have an AI application that they're really interested in. And so they have then subsequently partnered with, say, an AI scientist or an innovator to develop that. And so they've been actually nestling that. Two examples are chatbots that are in the process of development. So they've been actually much closer to the coal face of actually developing an AI application. So this gives you a kind of a picture of sometimes it's not, so the fellowship is not really about designing AI applications, although for some folks they may be at that stage. It is also about panning out to say, where are we at as an institution? Where do we need to be going? And really bringing that human-centered lens to that work. So it's not rushing out the gate too quickly without ensuring organizational readiness, a strategic vision, and even the infrastructure to be able to support any type of AI work that may be happening.
Great, thank you, Jen. Are international candidates eligible for the fellowship?
International candidates are eligible to apply for the fellowship. So it would be very interesting. In fact, we have one of our fellows right now who is working with a startup that's based in California. Happens to be Canadian, but is working in a startup in California. So we do have, in collaboration with our funding partner, AMS Healthcare, there are a few spots that may be open to fellows who happen to be outside the province of Ontario, say another part of Canada or internationally. One consideration for international applicants will be travel-related costs, which because the program is delivered with both in-person residencies and online sessions, the in-person residencies are designed with the understanding that all fellows will be present during those residency periods. It's not a hybrid model in that sense where we're offering dual delivery of people online and in person at the same time. The in-person residencies may have travel implications for some folks. And so that will be something that you would want to talk about with your institutional sponsor about whether or not you may be able to be enabled to participate in that way.
Thank you. If we're in two institutions, could we just use one institution support letter?
Sure. Yeah, I mean, many of us have kind of mixed roles and we wear multiple hats. And so if the leadership project that you'll be undertaking will be primarily in one institution or in relation to a particular sort of a particular set of institutions, you may actually want to be really specific about where that letter of support comes from, because it's really, but let me just qualify that. If one of those institutions is the one that pays your salary, and the other one is the institution where, in fact, the innovative work is going to happen, you might want to think about, is this a joint letter that says, yes, we're freeing you up from your professional responsibilities and to be able to take time out of your workday to work on this leadership project, but then also perhaps a supplementary letter that says, yes, and we as the receptor institution who's going to be partnering in relation to this leadership project, yes, we are also supportive. So it may be, you may want to think that through about what really underlines what constitutes institutional support if you have a partnered type of project.
Great. This upcoming question got a few support from people was asking, can you define mid-career for us?
So I sometimes use the, so within the research world, Canadian Institutes of Health Research defines mid-career as somebody who is within 7 years of completing their PhD program. So imagine mid-career would be having 7 years of leadership experience. Early career is somewhere around 3 years. And so this is where we are really open to a broad range of different leadership experience. I would say that that's where we sort of suggest that at least 3 years leadership experience provides at least a sort of a foundational basis in leadership insight of having been a leader. And so 7 is somewhere, that's where 7 to 15 years, you're sort of into mid-career. And then we do have some of our fellows, a couple of them, who have 15 plus years of experience, which as they will remind me, yes, they've been in leadership roles for a long time, but this AI, evolving and emerging AI environment is new. So they feel like they are back to mid-career in a lot of ways. Everyone is starting from a really interesting learning space when it comes to this particular health AI environment.
Great. We have a question that even I can answer. So the question was asking, what are the dates of the September in-person intensive? And in the past, we usually host this in the very last week of September. Jennifer, you correct me if I'm wrong. And then also asking if the interview for the application will be conducted in person or remotely. In the past, it's usually remote. Jennifer, have you actually?
Oh, it is only remote.
Okay.
Yeah, that's one we've made a decision just to make the interviews more accessible. We will host those online and everyone online. No, there's no requirement to be in person for those.
Great, thank you. Can you describe what kind of programming occurs in the in-person session then?
Okay, so the aim of the in-person session is ultimately to focus on types of activities that are better done together in a sort of an embodied kind of way than something that's online, which has, as we're all experiencing right now, it's kind of got a static sort of sense to it. So I would characterize those 2 residency days as more like workshops. So sometimes that may mean we will bring somebody in who they might be a demonstration of some work that they've been doing. So there's question and answer period that way. There's small group activity that really that small group activity that is designed really to support sort of more intimate shared learning experiences together. Sometimes we are our process facilitator, sometimes we're using the walls of the room to actually map out insights or visual images that we actually work with together on. So this is it's much more dynamic, it's much more action oriented, it's more interpersonal, and it's actually sometimes to where during the lunch breaks and the coffee break and the dinner between the Thursday and the Friday of the residency period, where some of the magic happens. Now, some of that magic, I'll just share, one of the things that has emerged from this is we'd originally conceived of this as individuals doing individual projects, which in fact everyone is, except that by virtue of some of the relationships that are now being built within the cohort in person, it's meant that sometimes there are sort of aligning as different types of mentoring groups. And so we're able within those residency groups to sort of cluster people with like projects together so that they can actually sort of provide sort of co-consulting support around those projects. And sometimes that is really facilitated by the opportunity to have some visuals that they can work with and so on. So imagine a workshop, imagine more like a sandbox, and much more of a socially engaged social learning space through those residency periods.
Great. Are there any technical competency brackets, machine learning, required for the fellowship?
No, 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 no worries about that. However, we do have a wonderful expert in residence who comes in and who provides a bit of an overview. It's about what the terms mean, how things work, and does so in a really wonderfully accessible sort of way. So there's no technical expertise that you must have in order to undertake this in terms of AI or data science. I would also say too, given the regulatory environment within which we exist, given the evolving and the changing legal landscape, you don't need to have a law degree either, but we will bring the expertise in from privacy folks who are experts in privacy law, working in the field. In fact, there was a change in legislation in our province, and the ministry that was responsible for that piece of legislation related to AI came and met with the fellows during the residency week to lay out what was going on and to elicit their thoughts and feedback. So, I mean, what we're really trying to do is sort of get to know the fellows once they come together as a cohort. What expertise do they have? What expertise don't they have? We try to curate to fill some of those gaps with some foundational level setting knowledge that's shared. But the other thing is, as well as we're realizing that many of these folks are really experienced as well, and there have been a few sessions over the past year where the expert in residence happened to be one of the fellows, and so contribute towards a co-led online seminar session on a topic area by virtue of the expertise that they had as well. So that was a longer-winded answer to your question about do you need to be an AI or machine learning expert? And the answer is no. But then that I think the way that we orient ourselves to this is that we're all learners in this space. Each one of us brings something, and we will work with you individually and also as a cohort to fill those gaps. And so this is where from cohort to cohort and year to year, it looks a tiny bit different, partly because the environment's changing, but also I think we are 2 years out from when we started the program. And I think that as a system, we're a little more familiar with what AI is and what it can do compared to before. So we try to listen hard to what you are sharing with us as fellows so that we can better meet you where you're at in terms of your learning.
Great. Upcoming few questions are more professional related. So let's start with this one. Are candidates expected to stay with the same institution throughout the fellowship?
Yeah, that's a great question. And so we have had one or two fellows who did change roles and change institutions midstream. And so ideally, you would be able to start and finish with the same institution just for continuity, but sometimes opportunities arise and it just makes sense for you to move on to something else. We will adapt with you. It doesn't mean that you are in one example right now, we have a fellow who is going through career transition. And with that fellow, we've said, great. So what does this mean for how can the fellowship support you? How can the fellowship continue to advance your human-centered leadership in AI, even through that transition? And so we're exploring different ways to support this fellow to be able to do that. And because that fellow's got lots of expertise, lots of insight, lot to share to help shape our contribute to our system. And so we will continue to support that. But the earlier we know, the better, because then we can actually work more with you to make sure that your the fellowship is there to support you. In some cases, it may no longer be what you need, but we will take that on a case-by-case basis and cross that bridge when we get there.
Great. Would holding a part-time academic role, such as an adjunct faculty role, be problematic for this?
I don't think so. I don't think so. I mean, there's no institutional reason why you couldn't hold an academic appointment at the same time. Just as there's no problem with you continuing to be a scientist in your area or having a research-related role. I mean, these are all assets and gifts that you bring with you. And so there's certainly within the University of Toronto institutional setting, having an adjunct appointment, wow, that means if it was at University of Toronto, great. Like, look what you get to bring back into your classroom, into your own teaching at the U of T. So no problem at all.
Great. This one is actually more in depth. So speaking for a ideal candidate, would you consider an experienced leader in a healthcare business consulting an ideal candidate? Main responsibility including engaging healthcare leaders, CIOs, CIMOs, CEO across the country on discussion around advanced AI, ML and digital strategy and data modernization.
That's really interesting. I mean, I think in some ways that just sort of reflects the diversity of different roles that we may play professionally within health systems, and some of those might actually be on a consulting basis. So that would be very interesting, and it would certainly not be Barry, but also bring a really interesting lens. One of the reasons why we were also interested to really think about the diversity of perspectives that people are bringing is that we can't all be in the same place at the same time. And so I'll give you a concrete example. One of the things that many of the hospital-based folks, fellows are experiencing is, well, gosh, we're not going to create a new AI, but our institution may want to license it. So how do we choose, how do we select which vendors to work with? Well, then it's interesting when you actually have a vendor in the room who said, well, here's the way we're looking at this, right? And then you can start to see there's a bit of a meeting of minds. Similarly, we have some of our fellows do have sort of a pan-Canadian type of role. And so they're listening and they're sort of gathering intelligence and insight from the tables where they sit and bringing that into the learning space so that all of us benefit from it. So if your professional role is something where you are engaging with executive leaders or working with leaders, what a rich contribution that actually might be to amplify a better understanding, not only of health leadership, but also better understanding of the types of issues that health leaders are experiencing and challenged by as they're contemplating what their institution may do in relation to health AI.
Great, thank you, Jen. I don't see any more questions in the chat. So if you still have some more last minute questions, feel free to post it in the chat for the time being.
And as mentioned before, welcome any questions that may come up simply by email to that email address that Terry had put into the chat for you. Welcome those. We'll get back to you as quickly as we can. And do by all means, if you want to, we'll get the recording cleaned up and ready for posting today so that you'll be able to circle back to it and sort of refresh your memory about what we talked about today. And really just I'm really excited about seeing who applies, what it is that is calling you to a program like this. We're very excited to see that. And then how we might be able to work together to identify the next cohort of AMS-Fitzgerald Fellows.
We have one question that just came in.
Okay, great.
Are there any additional costs associated with the program?
So we're very fortunate that AMS Healthcare is covering the costs. So as a gift to the Dalla School, is covering the costs of tuition, instructional materials, and sort of our associated administrative and catering and so on. So the only costs that fellows would incur would be any travel-related costs that you might have, say to get here. We have fellows, couple from Vancouver, one from Alberta, from Northern Ontario. And so that might be something that for those of you who are seeking institutional support, that's the sort of thing that you may want to broach with your institutional sponsor about ensuring that those costs may be covered for you to be able to come and participate in the fellowship.
Great. And then they're trickling in right now. So if someone meets all the eligibility criteria for the fellowship and has over 7 years experience in health sector, but is currently unemployed due to a recent layoff, are they still eligible?
I wouldn't say no. And the reason for that is this may actually be one of these just-in-time types of fellowship programs in state of readiness for whatever your career next step would be. I guess it would be something which it would be really important for you to articulate what type of project you might work on then. Because the part of the learning is not just what we do in residency and online. Part of it is that embodied experiential learning that you're engaging in, that form of professional inquiry, which is about your leadership project. So we'd need to have insight into what that might actually be. And it may be that this year is not the right year until you've got you've landed in your next position. But you know what I'm not saying no, because everyone's circumstance is a little different. And so you can shed light on what your circumstances are to the perhaps in your statement of interest. But the key thing will be, so what would a project be for you? And we can sort of take it from there.
Great. Don't see any more question at this point for the time being. Oh, just as we thought. Can a physician with many years of work experience who's interested in moving into a leadership role need to wait until they have gained experience?
So it's interesting. You may want to think about, I encourage you to think about how you might draw upon the number of ways in which you have played leaderly roles without having, say, a position title, right? So what we're really interested in is about where have you been working with people in order to bring about change or innovation, which might be in a community setting, or sort of voluntary capacity. It could actually be in an expert voluntary capacity or professional voluntary capacity. It might actually be something that is tied to your position within your institution. So each one of you will have a different type of leadership journey here that may be, I don't want to use this in any way in a pejorative sense, a small L leadership that is not necessarily tied to a job description or position, particular position, but you may have a sort of a collation of experiences that really illustrates your engagement in leaderly type of activity, bringing about change. It sort of shows how you're positioned well to a step into a leadership role. And so the program may support that. I will say that we did have one or two of our fellows who were much earlier in their professional careers, physicians who were slowly developing those leadership opportunities as they were going. And so, you may just want to sort of pause and, without humility, think about all of those ways in which, yes, you maybe have been influencing, collaborating, bringing people along around change, which would fall within that category of leadership in health.
Thank you, Jennifer. I guess we're 3 minutes from the time frame. Just any last minute question from our audience?
Well, Terry, I think these have been great questions. Thank you so much for all of the questions. And we are just really looking forward to your applications. So reach out if you have any further questions. Have a look at the AMS-Fitzgerald program page. And thank you for all the thank yous in the chat. That's really lovely too. We hope that this has been a valuable time well spent for you as you've learned more about this learning opportunity. And for those of you who have the opportunity to take a long weekend this weekend, I wish you a very, very happy one. And we'll hopefully be meeting some of you next month.